Hello friends, how are you? I think all you are staying home and safe. As Dr. Kikani sir have already explained the IPC, that is infection prevention and control. So I will go ahead with this IPC. That is your second session, that is infection prevention and control. Now first of all, what points to be kept in your mind, that we will go into the biomedical waste management first of all. So in this biomedical waste management, Dr. Kikani sir have already explained. So I'll go into the details of certain things, that is separate dedicated color coded bin bags or containers should be there for biomedical waste. The second point, that is maintain proper segregation of waste as per biomedical waste management rules. And most important thing, that is all the bag should be labeled with COVID-19 waste. Another points, like we should use double layer bag instead of single layer for the collection of waste. Second important thing, use dedicated trolley and collection bin, that is only for corona patients and their biomedical waste. Collect and store biomedical waste separately prior to the handling. Always remember, general waste should be disposed as solid waste. A very important point, that in biomedical waste, we are using disinfection. For the disinfection, we should use 0.5 to 1% sodium hypochlorite solution. And it should be for separate COVID-19 waste. Points to be kept in mind. Another points, that use personal protective equipments while handling the waste. That is very important, because these biomedical waste, if any healthcare worker is handling this biomedical waste, there is a risk of infecting that healthcare person with coronavirus. So we should use proper personal protective equipments while we are handling this biomedical waste. After using the PPE, the PPE disposal is another important point. Remember this, the gloves, plastic apron and goggles from the personal protective equipment should go into the red bag, while non-plastic items like mask, gown, cap and shoe cover should be go in yellow bag. You all are aware with biomedical waste management rules. Yellow bag contains human and animal anatomical waste, solid waste, expired medicines, chemical waste, body fluids and clinical waste. While in orange bag, contaminated waste are used, while in white bag, scalpels, blades, needles, syringes, which includes sharp metals, that is used. In blue color, the broken glassware or metallic body implants are used. So what is our goal in infection prevention while this outbreak of coronavirus? So our first important point is to reduce the transmission of coronavirus infection amongst community as well as healthcare workers. The second important goal is to enhance the safety of staff, patients and visitors. Third important point, to enhance the ability of organization and healthcare facility to respond to an outbreak. And the last goal is to lower or to reduce the risk of hospital itself applying the outbreak. So now, who is at the risk of infection? Most importantly, always remember one point, that all are at risk. Remember, while you are at the triage, remember this. Treat every patient as corona positive patient. So what is the benefits of this infection prevention control? That is, most importantly, you are protecting yourself. Second important, you are protecting your family as well as the community. And the third important point, you are also protecting your patients. So now, very important thing, that is personal protective equipments. We are using personal protective equipments while treating the coronavirus patients. So amongst them, which are the personal protective equipments we should use? So these are face mask, N95 mask, face shield, goggles, gown, apron, gloves and hand cover. So certain steps are there how to wear PPE. That is called donning of PPE. So now I will show you one video which shows how to wear PPE and how to remove PPE. That is very important points because that is one of the most important source of infection while you are using this PPE. So now I will show you the video.
Personal protective equipment, or PPE, refers to highly specialized clothing or equipment for protection against infectious materials. Medical workers who work in close proximity with cases that are either carriers or suspected to carry infection are recommended to wear PPE for protection to ensure complete safety. Before starting the process of wearing PPE, ensure that there are no personalized hand accessories such as rings, bangles, wristwatch or mobile on your person. The process of wearing PPE is as important as PPE itself, and the steps should be followed in the correct manner to ensure that the purpose of wearing PPE is not undermined. The first item of the PPE that is worn is the footwear covering. Aided by stretchable elastic, the covering snugly envelops the feet. To make sure that the cover is properly placed, wear them while being seated. After wearing the footwear covers, the hands need to be sanitized before proceeding. Hands should be sanitized using soap and water or microbial hand sanitizer. Soap should be applied generously using running water for more than 40 seconds. When using microbial hand sanitizer, apply a liberal quantity of the hand sanitizer on your palms. Rub vigorously for at least 20 seconds, making sure that no part is left out. Unfold the gown and roll it over your head. Using your hands, zip up the body gown and tie the strings behind your back. Make sure that the hair is neatly placed inside the gown. Straighten the gown around the neck, cuffs, and overall to be certain that it fits well. In case the gown is small, use 2 gowns to cover any place which could be exposed. Apply the headgear once the gown has been properly fitted. After placing the head cover correctly, put the hair in place. Ensure that hair doesn't stick out of the headgear. Fix the sides and apply the Velcro locks. The 3-layered surgical mask needs to be opened before putting on. Ensure that the folds are pointed downwards and the inserted metallic clip is on top. Using both hands, hold the upper strings and take them behind your head. After appropriately placing the mask on the mouth and the nose, tie the strings behind your head. Now repeat the same action with the lower strings. Adjust the strings and the metallic clip to fix the mask tightly around your face, leaving no gaps. To ensure the mask is fit properly, conduct a fit test by blowing air into the mask. If the air leaks around the nose or at the edges of the mask, then readjust the mask. Put on the goggles for eye protection. Fix the band of the eye goggles to ensure that the goggles are properly placed. The band should be placed over the headgear. This would also ensure that the headgear remains in place. The hand gloves are the last item of the PPE to be put on. It is advisable to once again sanitize hands before putting the gloves on. Hand sanitization is perhaps the single most effective tool against the spread of infection. Hold the glove at the upturned part and roll it over the palm as you go along. Pull the glove all the way over the cuff of the gown, and then holding the edge of the folded part, roll the glove down. This way your body will not come in contact with the sterile part of the glove. Repeat the same exercise with the other hand. Once both the gloves are on, stretch and lock your fingers to ensure proper fitting of the gloves. It is very important that the wearer keeps the gloves away from coming in contact with any part of the PPE after putting them on. After the mask is worn, it should not be allowed to loosen up or dangle around the neck at any time. If the mask gets damp, it should be immediately replaced with a fresh one. While replacing the mask, hand sanitization is a must before applying the fresh one. The discarded mask should be correctly disposed to avoid being reused. In case some item of the PPE, like goggles or mask, need to be changed, then one should always use a fresh pair after performing hand sanitization. While working with PPE, the medical worker should limit contact when it comes to items and surfaces. All PPE items have contaminated and non-contaminated areas, and the wearer should exercise extreme caution. Once the work is done, the PPE items will be contaminated and great care has to be exercised to ensure the proper disposal of the PPE. The process of removing the PPE should be done in a place that is clean and dry. PPE should be removed at the doorway before leaving the patient room or in the anteroom. The respirator should be removed outside the room after the door has been closed. Before embarking on the process of removal, ensure that the place has hand sanitizer and the biohazard bag for disposal. First to come off are the hand gloves. Insert the index finger under the glove and roll it up in a manner wherein it slides over itself as it comes off. Slide the index finger of the free hand underneath the second glove and roll it inside out over the already free glove. This way, the hands would not come in contact with the contaminated surface of the PPE. Once the gloves are off, they must immediately be thrown into the biohazard bag. Unzip the gown using your fingers. Pull the cuff outward as you pull your hand inside the gown. Using your hands from inside the non-contaminated area of the gown, take the gown off by pulling it down. As you pull the gown down, go along rolling it inside out. This way your hands will always be on the non-contaminated side of the gown. After the gown is completely rolled off, dispose it into the biohazard bag. Pull the band from behind your head and take the eye goggles off. Discard them by holding on to the band. Untie the lower strings of the 3-layered surgical mask first and then the upper strings. Ensure that you do not touch the contaminated portion of the mask and discard it holding on to the strings. Undo the Velcro lock and discard the protective headgear. Slide your fingers beneath the elastic into the non-contaminated area of the shoe cover and roll them down as you take them off. At every stage as you discard each item of PPE, it is advisable to perform hand hygiene as it reduces the risk of coming in contact with contaminated substances. If the medical worker observes that hands have become visibly contaminated at any stage of PPE removal, they should be washed immediately before proceeding any further. Normally, medical workers are required to wear a 3-layered surgical mask, but in the eventuality of dealing with live virus or suspected patient, it is advised to wear a particulate respirator such as the N95. To put the N95 respirator mask, place it on your face in a manner that it covers the nose and the mouth. Using the other hand, pull the lower string over your head. Once the lower string is comfortably placed, repeat the same action with the upper string. Once the strings are in place, use the index fingers of both hands to firmly clasp the metallic clip over the nose. This would custom fit the respirator over your face and will ensure safety. To ensure the mask is fit properly, conduct a fit test by blowing air into the mask. If the air leaks around the nose or at the edges of the respirator, then readjust the mask. If the mask is correctly placed, air should only come out from the front portion of the mask. In the case of the N95 respirator mask, roll your fingers beneath the band of the respirator and remove the lower strap first by bringing it over your head. Follow the same process and get the upper strap over your head. Without touching the frontal area of the mask, discard it into the biohazard bag. No matter what the duration of interaction with any suspected patient or sample, healthcare workers must exercise hand hygiene every time they come in contact with respiratory secretions. The well-being of the nation largely depends on the safety of the medical workers who toil hard in the field and labs across the country to combat infectious agents. The correct use of personal protective equipment strengthens their resolve by keeping them safe from the very infections they battle. Let us now see how much we remember about how to use PPE correctly. What does PPE stand for and what does it protect from? PPE stands for Personal Protective Equipment. PPE protects the healthcare provider from exposure to blood, body fluids, and respiratory secretions of the suspected patient. What can one do if the mask gets damp while working in the field or lab? Change the mask immediately. Do healthcare workers need to wear N95 mask at all times? No. This is required only when performing aerosol generating procedures such as intubation, mechanical ventilation, or when collecting samples of a suspected patient. What is the first item to be removed with regard to PPE after finishing work, and why?
As you saw in the video, how to remove PPE and how to wear the PPE. Now next is minimize the need of PPE. How can we minimize the need of PPE? Because PPEs are costly. So first is restrict visitors to corona ward. No patients except for corona patients are allowed in corona ward. Even no relatives are allowed in corona ward. Restrict healthcare workers for entering into the corona ward if they are not involved in the direct care also. In screening area, where we are screening the patients, whether they are COVID positive or COVID negative, whether they are having a flu symptoms or not, at their area also, restrict healthcare workers evaluating the suspect cases of COVID-19 disease. Use physical barrier to reduce the exposure to the COVID-19 virus. The next is where we can use students as sample collection procedure. So in how to collect this sample, that is very important because again it is also a source of infection. To always remember these are the certain steps. According to that you have to do this sample collection procedure. So please see the video.
COVID-19 diagnostics. performing a nasopharyngeal or oropharyngeal swab. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. Among other things, the examiner should wear an N95 respirator mask, gown, protective goggles, and gloves. To save resources, we will refrain from using each of these items in this video and instead only show the technical details of sample collection. Let's begin with the nasopharyngeal swab. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt the patient's head back slightly and support it with your non-dominant hand. If necessary, lean the patient's head against a wall to minimize jerky movements. Stand slightly offset from the patient to avoid the risk of contamination in case of a sudden cough or sneeze. Be sure to advise the patient of potential discomfort during sample collection and let the patient know that they are welcome to close their eyes. Sample collection should only be completed using sterile swabs made from artificial cotton with flexible plastic shafts. Calcium alginate swabs or swabs with wooden shafts must not be used. These materials can inactivate viral particles or inhibit PCR tests. Furthermore, wooden shafts are more likely to cause patient injury. Hold the swab like a pen between the thumb, index, and middle fingers. Maintain a loose grip that allows the swab to accommodate any resistance encountered during sample collection to reduce the risk of injury. Avoid using the following hand position during sample collection. Start by inserting the swab horizontally into the left or right nostril. Carefully advance the swab while maintaining a course that is close to both the septum and the floor of the nose, parallel to the palate. Do not advance the swab upwards, but instead straight back until resistance is felt as the swab reaches the posterior nasopharynx. When collecting samples from an adult patient, this corresponds to a travel distance of approximately 5 to 6 centimeters or 2 inches. Leave the swab at this depth for a few seconds while gently wiping the wall by twisting the swab shaft. Slowly and gently remove the swab. Immediately insert the swab into the sample collection tube, which may contain 2 to 3 milliliters of viral transport media. If a nasopharyngeal swab cannot be collected for any reason, an oropharyngeal sample can be also collected through the mouth. Again, inform the patient that the smear will feel uncomfortable for a short time and may trigger a gag reflex. Ask the patient to open their mouth wide, protrude their tongue forward, and say "ah." Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity without touching the lips, teeth, tongue, hard palate, or soft palate. These surfaces should be avoided as they are often colonized by a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall. Just as with the nasopharyngeal swab, the oropharyngeal swab should now be placed into the sample collection tube and sent to the laboratory as quickly as possible.
Now you have already understood how to collect the sample for coronavirus patients. Now next is the rational use of hand gloves. So which are the do's and don'ts for the use of hand gloves? Always remember, wear gloves only when it is indicated. Second point, remove gloves after single use. Do not use them repeatedly. Third point is, do hand hygiene before and after the glove use. And last point is, dispose these gloves in red bag after the use. Second important point is rational use of face mask. Where to use mask and where not to. The first is, use mask only when it is clinically indicated. Like for example, surgical mask should be used while handling respiratory patients, while N95 mask should be used where corona patients are there. Next point is always hold by its strings, means The mask should be handled very carefully, it should be removed very carefully, and while it is removed, use its strings to remove. Third point is always check the mask fitting. As you have already seen this procedure in the video. The last point is the discard the surgical mask after 4 hours of use and N95 mask after 8 hours of use. And these masks should be discarded in the yellow bag. In this new era, we all people are using mobile and laptops. But remember this, mobiles and laptops are again the source of infection. So always remember all these points. Avoid bringing all these mobiles and laptop to hospital. Clean his front and back surface very carefully with alcohol wipes. It should be done twice a day. And always switch off your mobiles as well as laptop while you are working in healthcare sector or in any corporate sector. So what is the take home message for COVID-19? How to prevent this COVID-19 infection? First is always avoid close contact with the people who are suffering from acute respiratory infections. Second important point that is very important, that is frequent hand hygiene, especially after direct contact with ill people or if you are going into their environment. And third important point, that is people with symptoms of acute respiratory infection should practice cough etiquette or respiratory etiquette, wear a medical mask or N95 mask or surgical mask. And third important point, they should immediately seek for medical care. Thank you.